Hi guys, so today I thought it would be helpful to talk about why it's not your doctor's fault that they can't help you with your IBS. And I know you have loads of pains and problems and those horrible symptoms, and then you go to your doctor and then you can feel like you're being let down when they don't give you the information or the help that you think you need. So they can give you medications and they can prod you, send you for more investigations and tests, and that's kind of the limit really. And I've had loads of patients and clients in the past where their doctor has attempted to help them by giving them some dietary advice. So the classics that I've come across that people have told me is their doctor said, go and eat more fiber, cut down fiber, or go Google the low FODMAP diet. And sometimes they don't even know what it's called. And I've had it like in written referrals where they've called it the FADMAP and all sorts of versions of that, and it's totally wrong. So they clearly don't know what they're on about. And the poor person goes away and Google it, and millions and millions of results. And there's loads of, as we all know, wrong information on the internet. But if you don't know where to go for the right information, then yes, a can of worms, and you can get it all wrong, and it can be difficult anyway, even with the right information. They'll go to the doctor, have loads of appointments, trying to get help because they're not getting any relief for their symptoms, and backwards and forwards, going to see specialists, gastroenterologists, or have loads of investigations, can take months, maybe even years, and there's still no further forwards. And all the while they're feeling more stressed, more let down, more frustrated and disappointed, and feeling let down by the medical system. I totally understand, that you can feel let down because you're not getting the answers that you want. But I'd like to share a different perspective, because although I totally feel for you, I can also, because I'm a clinical dietitian and I've worked in our health service, I can see it from the other side of the fence, if you like. And hopefully it will help you from being so frustrated or feeling so let down, because then when you're feeling frustrated and angry, worked up about your doctor, and when you feel like they're constantly letting you down and not giving you dietary advice or any other help that you feel that you need, then that could actually trigger your symptoms or make your symptoms worse. Average physician or average doctor doesn't study much nutrition, if at all, depending on obviously where they've studied and their interest. So there's a study in the British Medical Journal, how much nutrition medical students and doctors, how much training that they get. And on average, it's less than 2 hours training in nutrition. So they literally get hardly anything. So looking at from that perspective, if they're not getting the training in nutrition, then how on earth are they going to be able to help you in consultation in your appointment with your diet to help you manage your symptoms? Gastro consultants or GIs, depending on which country and how you know them as, they're basically doctors that specialise in the gastrointestinal tract, so the gut. Some of them know a bit of knowledge about nutrition, and I've had so many patients and clients that have been to see them, and they've then told me that their GI or their gastro consultant has told them, for example, to go and have some aloe vera supplements. Well, the clinical guidelines in the UK and other countries as well recommend against aloe vera because there's no evidence that it works. These gastro consultants, they're trying to keep up to date with everything within their scope of practice, but nutrition isn't, so they're not going to be up to date. So maybe previously, years ago, it perhaps was recommended. The aloe vera might have been recommended. They're not always right with the information that they do try and give when they're trying to be helpful and then giving you some, information and advice around nutrition. Some doctors have tried to be helpful and then they've tried to do like a mini consultation on the low FODMAP diet, and then they've basically cocked it up, unfortunately, and it's been wrong. And unfortunately, the person, they've then gone home and they're totally confused and stuck, and they just made things worse. The doctor's good intentions, and maybe the person has asked them over and over and over again, what do I need to eat? What can I eat that will help my symptoms? And there's a lot of people, they don't want to take medications, relying on the diet and other factors, and the doctors can't give them that information. And then moving on to another point is appointment times. So the average appointment time with your doctor is about 10 minutes. And then if you're waiting on the patient to come to you, they might get lost. They might not know where the office is, which consultation room they're meant to be going to. So that's a couple of minutes. And then the doctor might be running late anyway. And so that 10 minutes has basically been, started to be guzzled up. So they need to be focused. So as soon as that patient is in the room, as soon as you're in the room with the doctor, they want to get straight to it. How can they help you? And then talking about IBS, it's a complex and it's a massive area. So there's lots of factors that can play a part in IBS compared to, say, if I went to my doctor, so I've been for a run and I've gone over on my ankle and it's swollen, it's really sore, I can't weight bear, I can't walk on it or anything. They'll have a look, they'll be done and dusted, diagnosed, give me some anti-inflammatories, painkillers, maybe send me for a scan if they think that's necessary, and then send me on my way. Quick and easily done in 10 minutes compared to someone that's come in and then they're talking about their gut symptoms. There's lots and lots to cover, and there'll be a lot of things to talk about outside of that and how it's affecting them and their life, their family, their work that they potentially want to talk about as well. So that 10 minutes just isn't enough to talk about the clinical side of things and make a diagnosis, or if it's a follow-up appointment with the doctor to see how things have been, look at medications, whether it's prescribing or reviewing the medications and maybe switching to something else, to then move on to talking about diet. Because when I'm with patients and clients, 10 minutes isn't enough. And I'm a dietitian, so let alone a doctor where nutrition isn't their specialty, it's going to be really difficult to fit all of that in 10 minutes and to give the best possible level of care and advice and support that person needs. It's going to be a mammoth task and fitting it in 10 minutes. And then on top of that, you've got the caseload. And I get that it's not the person's fault, it's not the patient's fault that the doctors are overworked, stressed out, they're covering for their colleagues because they're off sick with stress or whatever. Maybe they're on leave, so there's staff shortages, there's sickness, the health service is understaffed anyway, the recruitment, so they're not getting people in to cover these places. They're trying to recruit from abroad, and that's difficult. So all of that, on top of the fact that being a doctor is a very demanding role and it's high pressure. So that's all going to add to the mix of making it difficult for why they can't help you with your diet, with managing your symptoms of IBS. And they are only human and they can only do what they can do. So yeah, they'll be working long hours. And I know many doctors that their days are very long, and then if they're stressed out, they might not be sleeping very well, so then they're not well rested by the time they're back in work the next day, and they can be on call out as well, so they can get called out through the night. Depending on how you are, they could reflect that back to you. So if you're feeling annoyed and stressed out because of your symptoms, if you're annoyed, frustrated, angry at the health service, if you're angry and annoyed, concerned about your symptoms and it's worrying you, and then on top of that, you don't know what's going on, then when you're told that your appointment is going to be in a few weeks' time, when the average in England, the average appointment time, wait time is 19 days. So that's a long time, especially when you've got gut symptoms and you don't know what's going on. It can be really worrying. So you've got all of this mental strain going on. And then by the time you get to the doctor's surgery and then you're sat there waiting, the doctor's running late, potentially you might have, that might be 10 minutes that you got to wait over your appointment time, or the doctor might be half an hour late, an hour late. I've known people that have been sat in the doctor's surgery waiting for their appointment 3 hours ago, and they've, bless them, they've patiently waited there for the doctor. And eventually the doctors come to collect them and took them and, you know, had the consultation. And all of this is all this pent up mental strain and frustrations. You can easily take it out on your doctor, and then the doctor, with all the pressure and stress that they're under as well, could, which isn't very professional, but we are all human at the end of the day, reflect that back to you. So then you've got like a clash of characters and a clash of emotions during that consultation. And guess what's going to happen? You're not going to get the best from that appointment. It's not really going to help. But I think they're key reasons. It's important to know what your doctor's going through as well, and maybe give them a bit of a break, even though I appreciate what you're going through as well. And it's super important that you get the help that you need. I believe that your physician, they can help you medically, they can prescribe medications, but not all medications work for everyone. And some medications aren't suitable for everyone. Diet and lifestyle can play a massive part in controlling your symptoms. So it's a matter of seeing the right person for the job, and a dietitian would be the right person to go to. So hopefully that's given you some things to think about and maybe helped you with your perspective and your appreciation of why your doctor can't help you. If you've got any comments, please put them in the box below, and I'll catch you all soon. Bye.